All right, and now I'm recording. Okay, so today, welcome to my free webinar on the pelvic floor called Performance Without Pain. And then before I begin, I wanted to give a shout out to the Institute of Clinical Excellence, Pregnancy and Postpartum Division. They're the ones that provided some of the content that I've included in my presentation. And a lot of the knowledge that I've gained, besides from physical therapy school, is from taking their courses. And they focus on helping active women throughout their pregnancy and helping them to rehab after birth, so they can return to exercising. All right, so my name is Kelsey, and I'm the owner of Anteater Physical Therapy and Performance. And so a little bit about me. I am a doctor of physical therapy and I worked in a regular outpatient clinic for 2 years before transitioning to working in my business full-time earlier this year. I've been doing CrossFit since 2012, and I've been coaching CrossFit for about 3 years. I recently got into triathlon and road cycling, and I'm also an Air Force veteran and was stationed in Minot, North Dakota for 3.5 years as a nuclear missile operations officer. My time in the Air Force is actually what led me to pelvic health. From having issues with leaking with running when I was in ROTC in college to finding out about pelvic health physical therapy from someone in my unit. And so it's that lack of awareness that pelvic health exists is why I'm doing this free webinar today. So today I'm going to be going over the anatomy of the pelvic floor and core, common issues of the core and pelvic floor, where leaks happen in CrossFit, and what's to do about it. See. Okay, oops. My mouse got stuck. Sorry, a little technical. There we go. Okay, next. All right, so about the anatomy. Even though we always say vagina when we're referring to female genitals, the part that we're able to actually see is called the vulva. And so the vulva starts with the clitoris on the front, so that's over here. And then you have an inner and outer labia that go along the sides. And then they surround the opening to the vagina here and the urethra. Vagina, obviously that's where babies come from, are born through, and then the urethra is where urine comes out. The anus is located separately in the back over here, and then the perineum is that area in between the anus and the vulva. So in total, females will have 3 openings: the urethra, vaginal opening, and the anus, while males only have 2 openings: the urethra and the anus. So next, I'll briefly go over the internal anatomy. So here's what the pelvic floor looks like without that outer layer of skin. And to kind of help you orient yourself, so up here, this part is that pubic bone. So like your pubic bone in the front. These 2 areas right here are your sit bones, like when you're sitting down, like the part that you sit on. And then this right here is your hip socket. So that's where your femur connects to. And then so on this model, pubic bone is up here, sit bones here on the side, and then right here are the hip sockets. And so there are actually 2 layers of muscles that make up the pelvic floor: a superficial layer and a deep layer. And it's that deep layer of muscles is what you feel when you're doing Kegels. And so here it's kind of showing those superficial muscles up here. This part back here, these are actually a deeper layer. And the superficial. So this is the anus right here. So there's the muscles around the anus that kind of help to, like, until you find a bathroom to like keep you from like soiling yourself. That's what that muscle is for. And then there's also superficial muscles here on the outside, and then those deeper muscles behind that are the muscles that you'll contract when you do Kegels. And this model, you can also see like some of those deep muscles here as well. And then, so what exactly does the pelvic floor do? So The pelvic floor, as this model shows, it has the organs inside. This is the ovaries, or not ovaries, uterus, and then this here that you can see in the front is the bladder. So the pelvic floor helps to support organs, and if someone's pregnant, it helps to support that baby or the fetus. It helps with sexual function, arousal, and orgasm, and it also helps us to pee and poop when we want to, ideally. And so the pelvic floor is also part of what we call your core canister. So if you think about your core, so like your core as a sealed potato chip bag, the sides are made up of your abs in the front and your back muscles in the back. So your abs and then your back. The top is your diaphragm, so the muscle that helps you breathe, and the bottom here is the pelvic floor. This core canister is important for helping to keep you upright, especially when lifting things such as your kids or weights in the gym. And so what happens when the core or pelvic floor is having issues? Well, to help keep you upright, your body is going to increase that pressure inside of your core canister. So think of it like kind of putting a book or something heavy on top of that unopened bag of chips. So when you put the weight on top, it's supporting that weight. But if you put too much pressure on it, or if you put too much weight on it, air is going to start leaking out from the areas that are the weakest. And so, disclaimer though, this is just an analogy, and it's not a perfect analogy. So I don't want you to think that, your organs are going to fall out like the potato chips coming out of the potato bag. Like, that is not going to happen. So yeah, imperfect analogy, but like in terms of pressure, that's a good way to think about it. Right. And so if you put too much, if you demand too much from your pelvic floor, then if you put too much demand onto your pelvic floor than what it can handle, what can happen are these common issues of the pelvic floor and core. So one of them is leaking, and that's going to be incontinence. And incontinence can be urinary incontinence, but it can also be fecal incontinence, so leaking poop, and it can also be like leaking gas as well. Next is diastasis recti, or diastasis. And that is the elongation of the space between your six-pack muscles. You can also experience a feeling of bulging or heaviness in the vulva. This is more commonly when women have prolapse, and then you can also have pelvic pain, or pain around your vulva, pain with sex. It can also be a contributor of lingering hip and back pain, where it seems like you've tried everything and it's not going away. Sometimes the contributor is pelvic pain or your pelvic floor. And so for the sake of today, I already included a lot of information. So for the sake of today, I'm only going to be talking about that incontinence piece and diastasis recti, as these are the most common issues that women deal with. And so first, I'm going to be talking about urinary incontinence. And then I'm just going to make sure no one else is trying to come in. All right. Still good. Okay. So urinary incontinence. This is the leakage of urine when you don't want to pee. And this can be like a couple drops, or it can be your entire bladder, or not the organ itself, but all of the urine in your bladder. So there are two main types: stress and urge urinary incontinence. Stress UI is caused by an increase in intra-abdominal pressure, so that pressure in your core canister. And this can happen with coughing, laughing, sneezing, lifting, all of that stuff. Urge UI, or urinary incontinence, is the sudden and strong urge to go right now. So some people will have a combination of both. They'll call that mixed urinary incontinence. But another type of incontinence to consider is actually called athletic urinary incontinence. It's actually basically stress urinary incontinence, but it only affects people when they're exercising. So people with what we're considering as athletic urinary incontinence, they'll be completely fine with coughing and laughing and sneezing, like that stuff. But when they're going to, like, for example, max out on a squat or deadlift, or if they're running long distances, things like that, that's the only time that they're going to experience that leakage. And so when thinking about incontinence, we have to kind of know, like, what exactly is normal for peeing. So women experience urinary incontinence more often and earlier in life than men. And so knowing what's normal for peeing is important for keeping good bladder hygiene, especially if someone is experiencing either mixed or urge urinary incontinence. So in general, you should be going to pee like about 5 or 8 times a day, or every 2 hours. And when I say every 2 hours, this is more for people who like work from home, and like the bathroom is conveniently right there. A lot of people during the lockdowns, for example, when they're at home, they were finding themselves peeing like every hour just because of that convenience factor when they didn't necessarily need to go. So you want to be peeing at least, there should be about a 2-hour gap between going to the bathroom. Adults under 65 should be able to sleep through the night without waking up to pee. Waking up, once every so often to pee is okay. So like one time in the night. But if you're under 65 and that's happening like every single day, you might need to address that. And it might not be overactive bladder. It might just be adjusting some of your habits. If you're over 65, waking up once a night to pee is normal though. And when you do go to the bathroom to urinate, it should take about 7 to 8 seconds to empty your bladder. So you shouldn't have to force the pee out or power pee, as some people call it. And if it takes you longer to empty your bladder, then that might signify that your pelvic floor muscles are not relaxing enough to allow that urine to come out. And lastly, you should be able, it's like if you suddenly get the urge to go, but you're not in a convenient place, you should be able to hold it if you need to. All right. And so next, here are some tips for keeping that pelvic floor happy in general. So number 1 is to stop sucking in your stomach. So this is a big thing for women. I don't think I was ever like explicitly taught that, but I feel like as a whole, women tend to kind of suck in our stomachs all the time. But if you remember that chip bag analogy earlier, if you're constantly trying to suck in your stomach, that pressure in your core canister is increasing overall. And so try to kind of relax, let go. Same thing if you're like me and you tend to be a little bit more high strung. Try to take some time each day to kind of relax, take a few deep breaths, and just, trying to let go of that tension. Another tip is to not try to Kegel every time you lift or exert yourself. And so there's a little caveat to this. Kegels can be a good strategy to learn pelvic floor muscle coordination and to work on that strengthening in the beginning, but your pelvic floor is like a reactive muscle. So your pelvic floor should be able to work on its own reflexively without you having to think about it whenever you go to whenever you sneeze or cough or go to pick up something. So try not to do a Kegel every time you lift. And then lastly is to work on general strengthening. So any exercise can be a pelvic floor exercise or is a pelvic floor exercise. And as someone who enjoys lifting heavy weights myself, I'm always going to advocate for incorporating some sort of strength training. It doesn't have to be super heavy, but at least some sort of strength training into your exercise routine. And there are also new studies coming out showing that the stronger you are overall, the stronger your pelvic floor is going to be as well. So next is, where can leaking happen? So when it comes to leaking in the gym, stress or athletic urinary incontinence is going to be that main culprit. And that's where what I'm going to be touching on next. As I mentioned earlier, Stress UI can happen with anything that increases your intra-abdominal pressure. So that's going to be like that coughing, sneezing, laughing, running, jumping, lifting heavy weights. Athletic UI is leaking only when exercising. So just, the running, jumping, and then the lifting the heavy weights. And they're not going to have problems with the coughing, sneezing, and laughing. Urinary incontinence in general happens to about 48% of female athletes and 44% of CrossFitters. So if this is happening to you, especially if you're experiencing that athletic urinary incontinence, know that you're not alone. Like you're not the only one, and it's not just a you thing. That's what a friend's husband told her. It's like, oh, maybe if you're leaking with double unders, maybe it's just a you thing. Nope, it's not just a you thing. This happens to a lot of women. And this also happens to a lot of women who have never been pregnant, have never had kids, including, such as myself. So first, if you pee while if you pee while sneezing, you can try this. So a good strategy to use for this in the beginning, so again, temporarily, is called the knack. I'm not sure why it's called that, but what it is doing a pelvic floor contraction right before you sneeze or cough or like do the thing that's going to cause you to leak. So like I mentioned before, this is a good strategy in the beginning as you're working on the pelvic floor coordination and pelvic floor strengthening. But as those two things improve, you shouldn't need to do the knack. Obviously, there's going to be some exceptions, but in general, this is a good thing to try in the beginning. So we can practice this all together now. So for the knack, for a pelvic floor contraction, when you do a Kegel, which is a pelvic floor contraction, you want to think about the vaginal opening, not just closing, but also lifting. So it's going to be like a squeeze and lift. And so to do the knack, or a pelvic floor contraction, you're going to make sure you're sitting up tall or standing up tall, and then perform that pelvic floor contraction. So imagine you're picking up a blueberry with your vaginal opening or with your pelvic floor muscles. And if you feel your butt clench, you're using too many muscles. You're not using your pelvic floor, you're using your butt muscles. So try to relax and then think about your vagina basically picking up a blueberry. So you will hold, for the knack, you will hold that pelvic floor contraction. You'll sneeze, cough through that sneeze and cough. And then as soon as you're done, relax your pelvic floor. So the second part to a pelvic floor contraction is also being able to relax those muscles so they're not constantly having that tension. And again, this is a temporary solution, and your pelvic floor should be able to do this reflexively as your pelvic floor strength and coordination improves. So next, let's talk about peeing with jumping. So if you're peeing with jumping, if you're doing something slower like a box jump, you can try to do the knack before each jump. However, remember to relax your pelvic floor in between and not hold a contraction like the whole time you're doing the box jumps. So once you land or jump or land, you'll relax, and then before you do that again, you'll do that knack. The reason why we don't want to hold the contraction the whole time is because it can lead to that pelvic floor muscle fatigue, and that fatigue can lead to leaking. Another thing you can work on is your landing mechanics. So when you're jumping, you want to try to make sure your ribs are stacked over your pelvis, so you're not kind of like bent over too much. I know it's hard as you get tired, but try to maintain your ribs stacked over your pelvis. And then when you land, try to land softly to try to decrease that impact or that jarring motion. So if you're doing jump rope or running, so something a little bit more repetitive, obviously you're not exactly going to be able to do the knack here because that's a lot. So for something more advanced like jump rope or running, you still want to keep that good posture. So a good cue I like is from Brianna Battles, and it's to keep tits over toes. So you want to try to keep your ribs stacked over your pelvis when you're jump rope, or even when you're running. Like try not to run like bent over, doubled over like that. You want to also try to relax a bit and land softly. So for jump rope, that's going to sound counterintuitive, but try to just kind of relax and then let your pelvic floor try to like do its thing, reflexively contract during each jump. And also for jump rope, trying to keep your hands in front of you, because so this picture is what you should not do. So like her ribs are not stacked over her pelvis and her hands are kind of behind her, so it makes her like this. But if you keep your hands in front of you while you're jumping rope, that kind of helps to keep your ribs stacked over your pelvis. Again, don't try to hold a Kegel the entire time you're jumping or running. Like I mentioned before, sounds counterintuitive again, but try to relax. And for the jumping, trying to do a long exhale. So like inhale while you're jumping in, jump, and then inhale, and then exhale. So that also helps you to not hold your breath the whole time. And lastly is being able to do or using intervals. So for jump rope, for example, if you're able to do like 10 jump rope or 10 double unders before you start leaking, then you might have to do your 10, stop, take a break, couple breaths, reset, and then do another 10. So, and then as you get stronger, you can try doing 11, so on and so forth. Excuse me. For running, same thing. If you know you're able to run like 30 seconds before you start leaking, then you'll do run walk intervals. So you'll run 30 seconds and then you'll take that time to kind of try to relax. And then walk for about 30, 60 seconds and then run again for 30 seconds. So you'll do intervals that way. That way you're allowing your pelvic floor to kind of relax, but you're still able to do the thing that you want to do. So next I'm going to talk about peeing with lifting. So having good bracing technique is extremely important if you're peeing with lifting. If you use a weightlifting belt, having the right size of belt and using it correctly is also important. If you want to know more about lifting belts, I'm not going to go over it today, but I did make a weightlifting belt guide. It's on my Instagram. It's a 3-part series and it's under free guides. So, and then I'll show my Instagram handle at the end, but you can check that out if you want to learn more about weightlifting belts. So to brace properly, you want to make sure that you're not just like sucking in your stomach or even like pushing your stomach out. With the weight, going back to the lifting belts, I know like that's a common cue that a lot of times they're like, yeah, just push your stomach out against the belt. Actually, that's not what you want to do. And another thing is you also want to make sure you're not pushing down into your pelvic floor. And the best way to describe that is if you're that sensation, like when you're trying to poop, basically while constipated, like just pushing down, like you don't want to do that either when you're trying to brace. So to find your brace, you will just like breathe out all the air from your lungs. And then as you're doing, so like standing up or sitting up tall, as you're doing that, you should kind of feel your stomach muscles contracting. And then, so that's going to be your brace. So try to hold that. And then now like breathe in and out. So, and instead of thinking of it like your stomach moving, think of your rib cage expanding while you're breathing. So hold that brace and then take a few breaths to kind of get the hang of it. So that feeling in your abdominals, so that's your brace. And so another thing to think about to kind of help when you're bracing, you can imagine like someone going to like punch you in the stomach, or another one is like imagine like your baby is jumping on your stomach or something like. So that's what bracing should be. You're contracting those muscles. You're not necessarily like sucking in your stomach and you're not pushing your stomach out. So as you build up your strength and capacity for certain weights, you may have to change the way you breathe while you're lifting. So at lighter weights, you might be able to breathe and, brace and keep breathing throughout the whole lift. But as the weight gets heavier, a lot of times we tend to hold our breath while we're lifting, which is absolutely normal, and that's good. However, sometimes that can increase that pressure, that intra-abdominal pressure, a little too much. So a good strategy for that is during like the difficult part. So for example, on a squat, is the standing up part is to slowly exhale. So usually it's that like that hissing sound. That way you're still maintaining that intra-abdominal pressure, but you're releasing some of that pressure, preventing it from causing that leaking. And another thing is, or same thing with a lifting belt, because some women might be able to wear that belt until a certain weight, and then they start leaking. But if they try to lift that same weight without the belt, they don't experience leaking. So again, that belt is going to add to that pressure, and that increased pressure. It's a good thing when you want to lift, but in terms of like peeing while you're lifting, you might have to hold off a little bit until your pelvic floor gets strong enough to withstand that increase in pressure. So not forever, but just temporary. And so that is peeing with lifting. And again, if you have any questions, there should be a Q&A box, or you can put it in the comments and I'll answer all questions at the end. All right, so next I'm going to talk about diastasis recti, or diastasis, the two different ways to say it. So again, diastasis recti is the elongation or the widening of the fascia between your six-pack muscles here. So what I want to make clear is that there's not a hole. So, I mean, it looks like a hole, but it's like your organs are not going to fall out. So it's not necessarily like the muscle is tearing. The muscle is not tearing. It's that in between your six-pack muscles, so these two right here, there's a piece of fascia called the linea alba. And so that's the part that gets stretched out. So it's not a hole, it's just kind of stretched a little bit. Diastasis recti happens naturally to all women during pregnancy. And it's just a part of the normal body changes to accommodate that growing fetus. This can also happen to overweight or obese men and women, but like men will see that too. Or you'll see it in men as well. So it's and for most women who get diastasis recti while they're pregnant, once about the 6 month mark, sometimes earlier after giving birth, usually it kind of resolves on its own. Like everything, like the fascia kind of gets a little bit less stretched, and it just resolves itself on its own. But for some women, some postpartum women, you'll need a little extra help to improve that diastasis or improve that core function. And again, it might be from a strengthening issue, or it might just be a genetics issue. So not anything bad. It's not your fault. It's not through any fault of your own. It's just kind of one of those things that happens. So, but there is a way to help with that. In very, very rare cases, some women might benefit from surgery to help with it. But again, those are rare cases. For the majority of women, it either resolves on its own, or they might just need to do a little extra work to help it along. So the next important thing to know is that despite what Instagram and TikTok influencers say, there are no unsafe exercises if you have a diastasis, and coning is not a sign of you making anything worse. So remember what I said about, men or obese men or men with obesity, like they have diastasis recti and they cone all the time. They do sit-ups and everything, like, and no one bats an eye. So, but just when it happens to women, everyone's like, oh no, like, not safe. So So remember, like, it's not unsafe. Or there, you can do sit-ups if you can, if you want to. And coning is not you making anything worse. And then I'll talk about that a little bit later. So next is checking, how to check yourself for a diastasis recti. So to check to see if you have a diastasis, you're going to lay on your back. And then, so ideally you'll move your shirt so you can kind of feel your skin. And then you'll sink your fingers along the line. So along the line between your belly button and your pubic bone. So, and it's in the center. So I'm showing, I don't know if my camera, nope, the camera can't see. So if my belly button is here, it's going to be here, and then also in between. So in that center right here. So you're going, so like in this photo here, you're sinking your fingers into your stomach along the line between the belly button and your pubic bone. And then, so you'll put your fingers, and then you'll lift your head up. And then if you don't have a diastasis, you should feel your fingers kind of like bounce up. So if you can imagine like her fingers, because you'll also check in between your rib cage and your belly button. So for this photo, if the person this person laying down like lifted her head, if there's no diastasis, the fingers should just kind of come up, and it's kind of it would feel like a trampoline, if that makes sense. If there is some like core dysfunction, so like a diastasis, then the fingers will kind of just stay where they are. And what that means essentially is just that this person is not able to use their core very well. I don't want to say properly, but they're just not able to coordinate that muscle contraction in her abdominal muscles very well. And so they just need a little bit help with that coordination and strengthening. So when we're checking for diastasis, there are a couple of things we're looking for. One of them is the width, but there was a new paper that came out very recently within like the last couple months because before we were concerned about if this gap was like 2 centimeters or longer, or sorry, 2 centimeters or wider. And when I say gap, just kind of like the gap between the edges of the abdominal muscles. However, that paper found that there were, they looked at MRIs of like a whole bunch of people that weren't there for diastasis. They got MRIs because they had like, like some sort of organ thing. And they measured the distance of everyone's linea alba. And there were a ton of people with 2 centimeter wide gaps or wider that didn't have any sort of like core dysfunction at all. So that 2 centimeter rule is kind of like, we don't know where it came from, and it's probably not something that we can continue to use, or it doesn't really give useful information. I guess that's a better way to put it. So what we're really looking for, or what I'm really looking for, is that that depth. So like if you're not able to sink your fingers in, great. If you do sink your fingers in, but when you lift your head or do a core contraction, your fingers come out, and so it's like that trampoline feeling, then that's good. That means that your core is functioning properly. So yeah. All right, so next are some core tips. So to help you with the exercises in the gym, a little bit more specifically for CrossFit. So again, good bracing technique is going to be key here, especially for being able to like feel your core. So I know a lot of women, after, like they're cleared at that 6-week mark, and then they'll try to go to the gym, and then a lot of women have told me like, I can't really feel my core. So having that good bracing, working on that good bracing technique is going to kind of help with that. And there are a couple things you can do for that. So one of them is that exhale that I mentioned earlier. It's the same, very similar, same technique as when you're lifting for that bracing. Again, same thing as lifting, exhaling on the difficult parts of um, whatever core movement you're trying to do is going to also help with feeling your core or using your core. And then once you're able to have that connection with your core again, specifically for CrossFit, but also just for life in general, that strengthening in that hollow hold position is going to be very important. But also strengthening in other directions as well. So rotation, like Russian twists, and even doing things like sit-ups. So the things that a lot of influencers tell you not to do, those are actually very important for diastasis. So I was just at a course a few weeks ago, and one of the women there, she had her two kids very close together. I think they're 11 months apart, and so she, like, after her first one, she didn't really have a lot of time to kind of rehab her core. So her core is very weak after her second child, and she was also a physical therapist. I was at a course for physical therapists, and she was saying she did all like the standard like things that they tell you to do for diastasis, and like she just kind of hit a plateau for her diastasis, and eventually she started, because she took the same courses that I took from the Institute of Clinical Excellence from ICE, that they're more fitness forward. And so she started incorporating more of like the rotation stuff, more of like the sit-up stuff. And she said, and so that ended up being what helped push her like over that little hump. So what helped her to continue to see gains, and her core is pretty good now. So I know that's just one person, but I mean, it's not just her though. Like everybody, like hollow hold, good, plank stuff, stuff like that, good. But adding the rotation and the sit-ups when appropriate, so when you're ready, that's going to be that next step of core strengthening for that. And then lastly, so that coning again, you don't need to be afraid of coning. So before we're like, oh no, it's like you're not using pressure properly, but now we're realizing like, actually, like, is anything bad happening? Actually, probably not. So for coning, instead of being afraid of it, kind of use it more as a sign of fatigue, more of a sign that your core or body is getting a little bit tired and you need to take a little break before you continue with your exercise or things like that. All right. So that is all I had for today. Thank you so much for attending. And since I'm recording, for those of you watching, thank you for watching the replay. I'll start the Q&A shortly if you have, but if you have any other questions after, or for those of you on the replay, you can find me on Instagram at Dr. Coach Kelsey DPT. You can also email me at kelsey@anteaterptp.com. And then my website is anteaterptp.com as well. If you want me to demo the tips I went over today in person, I'm also able to do live in-person seminars. So you can ask owner of your gym to see if they'd be willing to host a seminar if you're interested in that. All right. And then so that's all I had for today. It's 40 minutes in. So with that, are there any questions? Let's see. No questions. And I'll go ahead and stop recording. Let's see.